So we can move on to the next topic. The next topic: sterile and aseptic processing. Sterile and aseptic what? Processing. Sterile and aseptic processing. So here, when you hear sterile, what comes to your mind? When you hear sterile, what comes to your mind? Sterile and aseptic procedures, what comes to your mind? Please, I want this class to be contributory, please. If you hear sterile and aseptic processing, what comes to your mind?
Good evening, sir.
Yeah, good evening.
Sterile means a product that is 100% free of microorganisms.
Okay. Okay. What of aseptic procedures of processing? What is it all about?
Free of aseptic.
Aseptic, ASEPTIC. So those ones are those things you do, to ensure that what you are doing is sterile. Am I communicating? Huh? All the steps you take, what you do and what you don't do to ensure that where you are working, the environment you are working, or what the product you want to produce is what? Sterile. So all those things you take, they are called what? Or techniques or whatever, they are called the aseptic what? Techniques. Are we together? All right, so sterility and aseptic techniques are very, very essential in pharmacy practice. So this will, as you said, it will help to do what? Prevent contamination. And at the same time, it will help to ensure quality of the sterile preparations. So this one now, remember, not all the preparations are sterile. Not all the preparations are meant to be what? Sterile. But by the time before the end of this class, by the end of this class, you will now be able to distinguish the product that are supposed to be sterile and the one that must not necessarily be what? Sterile. So the this techniques is essential to prevent contamination, as I said before. Now sterility actually refers to complete. Whenever you hear sterility, it talks about complete absence of microorganism. Complete absence of what? Microorganism. That's what sterility is all about. Why the aseptic techniques talks about the method. I think I've said it before now. The method, the methods you use to prevent contamination during the preparation of what? Sterile products. Now, so let us now define the two terms properly. So how can you define sterility? Sterility is defined as the complete absence of microorganisms, including bacteria, viruses, fungi, and protozoa. So all bacteria, fungi, and protozoa. Sterility is essential in pharmacy practice to prevent these things from entering the preparations. Now, aseptic techniques can be defined as a method used to prevent contamination during the preparation of what? Sterile products. So these techniques involve the use of sterile equipment. So you start from the equipment. The equipment need to be sterile. So you start from the use of using sterile equipment, using that supplies have to be what? Whatever you other ingredient or whatever supplies you want to use must be also be what? Sterile. And even the personnel, equipment, supplies, and personnel. So this is geared towards preventing the introduction of what? Microorganism into the what? Preparations. All right. Now, how do we now, what of what importance is having the room where you are doing the compound formulation clean and the environment control? Hope you know that. Are you aware that the room can be clean where you are doing this preparation, can be free of these microbes, but if you don't control the environment, it's also another issue. So let's look at the importance of clean rooms and controlled environments. So clean rooms and controlled environment are very, very critical in sterile and aseptic what? Processing. Of course, you all know that it helps to prevent contamination. So what do you understand by the term clean room? Let us look at it. What do you understand by the term clean room? So a clean room is a controlled environment with minimal airborne particles and microorganisms. So clean rooms are designed to provide a sterile environment for the preparation of what? Sterile products. So it's not just about the desk and other equipment. The room itself, the air there should be filtered. The air there should be devoid of what? Of microbial what? Infestation. Now let's look at the types of clean rooms we have. Types of clean rooms. So there are several types of clean rooms. They are as follows. We have class 100 clean room. Class 100 clean room. So class 100 clean room is a clean room with a maximum of 100 airborne particles. Airborne particles per cm cube. Class 100 clean room is a clean room with a maximum of 100 airborne particles per cm cube. Then we also have 10,000 class 10,000 clean room. Class 10,000 clean room is a clean room with a maximum of 10,000 airborne particles per cubic cm. While class 100,000 has maximum of what? 100,000. Now, what do you now understand by the term controlled environments? What do you understand by the term controlled environments? Did you hear what I said about clean rooms before I go to controlled environments? Huh? Please talk to me now. Let me know that. Let me know. Let me be sure I'm not talking to myself. Huh? Hello? Are we there? Are we there?
Yes, sir.
Are we tired? Or is it
We
network? Which
are half
one?
tired, sir.
Is it network? Is it network? What is the issue? The response doesn't come fast. Is it network?
Yes, sir. The network here
Eh?
is sir. Yes, sir. The network is poor.
Chai.
The
What do you do
network
now?
is poor, sir.
Have you seen why I prefer early morning lecture? But this is why I prefer early morning lecture.
Yes, sir.
Because no disturbance. Everywhere, marama, no disturbance. Anyway, let's see how far we can go. Instead of you not understanding what we are saying, if it will stop, maybe we can stop. But anyway, you can still watch the lecture because I'm recording it anyway. Maybe after I'll send you a link. Those places you miss because of network, you can still watch them. It's better than stopping entirely.
Okay, sir. Thank you, sir.
Okay. So let's look at what is it called again? Let's look at I was talking about clean room, right? No, sorry. I entered controlled environments. I entered controlled environments. So let's look at controlled environments. Let's look at controlled environments. All right, let's go. So what do you understand by the term controlled environments? Controlled environments include include use of laminar flow hoods, biological safety cabinets, and the what isolators. Now, this whole thing I mentioned now provides sterile area for the preparation of what sterile products. Laminar flow hoods, biological safety what cabinets, and isolators. There in the room we have these things are there provided to control whatever enters or goes close to that area. So this we devoid this will not totally remove anything concerning microorganism from coming near to where the particular spot or corner where the the sterile product is being prepared. Now, what are the techniques for compounding sterile preparation? So let's look at the techniques. We are now into the techniques proper. How do we now compound sterile preparations? Of course, basically the techniques you should look at for is watch out for is what? Starting from hand hygiene. Hand hygiene. So the hand must be thoroughly washed and dried before starting the compounding process. So hand hygiene is very, very essential because it prevents introduction of microorganisms into the what preparation. Now, use of gown and glove. Use of gowns and gloves. So the personnel must wear sterile gowns and gloves. So this prevent, you know that your skin, the skin also has their own flora. You know what flora are? You know what flora are? Microbial flora. These things are normal microbes that inhabit some part of our body that they're not causing any harm there. But if they leave that particular part of the body and enter another part of the body, they can become harmful. So we call them flora. They are normal flora in that area. So on the skin, we have normal flora on the skin. Normal, they are there. They're not causing any issue in the skin. So if you are not completely covered with sterile gowns or gloves, you can introduce this flora into the what preparation. And of course, if somebody takes in this if it is an oral preparation and the thing finds its way into the person's body, it can cause harm, even though it does not cause any harm on the skin. And apart from the patient taking it, the consumer taking it, it can also cause microbial degradation of the product. It can also cause what? Microbial degradation of the what? The product. So it's good to cover ourselves properly with sterile gloves and sterile gown. The next technique is cleaning and disinfection. So of course, if all the equipment and surfaces must be cleaned and disinfected before use. So cleaning and disinfection is essential. Of course, you should know that it's there to prevent introduction of what? Microorganisms into the what? Preparation. Into the what? Preparation. Alright, now the next technique is aseptic manipulation. What happens here? Here now, the personnel in charge must use this technique in handling sterile equipment. So this manipulation is very important to avoid what? It's just about being careful, know how to hold whatever you want to hold, how to add any ingredient, and how to place whatever equipment you want to keep, how to keep it. Maybe you still want to use it again. All those things is under this aseptic what? Manipulation. Then the next one is sterilization. Very important. Next one is sterilization. Very important. So sterilization is also a technique to ensure that you did whatever you are doing properly. So this method, there are some method of sterilization like autoclaving, like dry heat sterilization. These ones are there to sterilize equipment and preparation. They must be used to sterilize equipment and what? Sterilization. So sterilization is there to ensure that all these things and both the preparation are sterile. That is basic thing you need to understand about what? Sterilization. In fact, when applied to pharmaceutical preparation, when we say sterilization, we mean destruction of living organisms. Not just living organisms, even their spores. It means destruction of living organisms, their spores, and complete removal from the preparation. Killing the microorganism, their spores. You know what spores are? If you kill the organism and their spores are still there, the spores will do what? Regenerate and continue. So the sterilization is targeted at killing the organism and their spores and removing entirely from the what? The product. That's what we mean by sterilization in pharmaceutical preparation. Now, let's look at the methods of sterilizing pharmaceutical products. So there are 5 methods I want to mention. The steam method or gas. We have the dry heat. We have steam or gas. We have dry heat. We have filtration. No, let me separate this. Let me separate this. Let me separate this, because not all steams are gas. Not all gas comes from steam. Let me just say, let me do it. Let me separate steam and gas. Steam sterilization is there. Then dry heat is there. Filtration is there. Then steam proper is there. Then gas is there. Then ionization and radiation. Ionizing radiation is there. So let's start with steam sterilization. So what is steam sterilization? What is it all about? Here, autoclave is used here, and the steam used is under what? Pressure. Steam under pressure is used. In fact, this one is normally used if the products can withstand it. Because there are some pharmaceutical products that cannot be heated safely. There are pharmaceutical products that cannot be heated. If you heat them to a particular temperature, they will spoil. So what do we now do? We can use what? Steam sterilization to sterilize them. Now, when there is moisture, when moisture is there, then bacteria will do what? Coagulate and destroy at very low temperature than when it is moist, when moisture is absent. So at the same time now, spores, there are some spores that have relatively low percentage of water, and these ones are very difficult to destroy. So the mechanism of here now, using moist heat here, may denature and coagulate some of this microorganism protein. So steam sterilization is applied when you have bulk solution. For bulk solution, when it's used to sterilize bulk solutions, glasswares, surgical dressing, and instruments. But it's not useful for oils, powders, and other substances that cannot be penetrated by water. It's very important. So when it comes for ample injection and even cell vials, it can be used to sterilize them too. Now let's look at dry heat. Dry heat. In dry heat method, oven is used. This one is normally carried out using oven. So here now, are we together? Hello? I want to be sure that you are with me. Oh.
We
Hello?
are with you, sir. We are with you.
Are you sure? All right, so
Yes, sir.
now let's look at dry heat. Let's look at the dry heat. I said that oven is used for dry heat what? Sterilization, right? I said that
Yes, sir.
oven is used for dry heat what? Sterilization. Now,
Sterilization.
now this oven is thermostatically controlled. Is thermostatically what? Controlled. This one is more effective than moist heat, but not for every product. So what happens is that this one, it needs very high temperature and longer what? Time. So it's used for substances there are substances that cannot be effectively sterilized using dry heat, using moist heat. They can be used for what? We can use dry heat method for such products or equipment as the case may be. Now, you use it to sterilize glasswares and surgical instruments. They used to sterilize glasswares and what? Surgical instruments. Things like oils, glycerin, and various petroleum products like what is it called? Paraffin can be sterilized using what? Dry heat. I've mentioned preparation. The key point I want you to look at in this sterilization method, look at the preparation that can be used. You can use it to sterilize, and look at the equipment that you can use it to do what? Sterilize. For the equipment, it can be used to sterilize glasswares and surgical instruments. But for the products, it can be used for something like oils, glycerin, and various petroleum products like paraffin. We can use dry heat to do what? Sterilize them, because moist heat cannot effectively sterilize it. Remember that water cannot penetrate them easily. Remember what we said about penetration of some oleaginous substances. That's what they call them. Those one that cannot be penetrated by what? Water. Of course, it can be used to sterilize powder too. Now let's look at sterilization by what? Filtration. Let's look at sterilization by filtration. Now, anyway, here it depends on the microorganism you want to remove. Depends on the microorganism you want to remove. Now, are you aware that there are some filter there are some filter medium you will use because of the size of the pores. Some of them, the size of the pores are even smaller than the size of microorganisms. Some of these microbes, their pore size are very small, very small in size to compare with the size of these microorganisms. So if you use them now to filter these products, this microorganism cannot pass through their pores. So that's why sterilization by filtration can be used. So they are mostly used for extemporaneous preparation solution like ophthalmic solution. Ophthalmic for the eyes. Remember that solution for the eyes should be sterile and it should also be what? Isotonic. Remember that. Okay. So now this particular method has a problem. It has a disadvantage. Disadvantage here is that the membrane for this filtration tends to be fragile. That's the problem. So it's very important to determine that this thing, the membrane, everything you are doing, ensure that the membrane is not ruptured or flawed, because if the membrane ruptures, what you are doing is rubbish. Everything will pass through. So that is the only issue, that is a disadvantage of this method, that the membrane is fragile. So whatever you are doing, ensure that the membrane, that is the medium through which whatever you are doing, ensure that this membrane is not ruptured. Very important. All right. So now, but one advantage of this method is that it filters small quantities of solution. That the speed in the filtration of these small quantities of solution is what? Is high. The speed is high, and it can actually be used to sterilize thermolabile materials. Very important. Thermolabile. Here now there's no heat, nothing. So it can be used to filter thermolabile material. Please note that point. It can be used to filter thermolabile. Thermolabile materials are the materials that can be destroyed by what? Easily be destroyed by heat. So they can be used to filter thermolabile materials. And they are relatively, they are not that expensive to compare with others. They are not that expensive when compared with others. So these are some of the points I want us to note on the sterilization using what is it called again? Using filtration, filter membrane, using filtration. Now let's look at filtration by using, let's look at gas filtration. Let's look at gas filtration. Let's look at gas filtration. In gas filtration, enzyme oxide like propylene oxide gas is used for the sterilization. Enzyme oxide and propylene oxide gas are used for what? For purification. But these gases are flammable when mixed with air. So, but they are safe when diluted with inert gases. So this sterilization requires specialized equipment like autoclave, And ethylene oxide requires like 14 to 16 hours exposure, and this interferes with bacterial cell metabolism. So this one is used to sterilize catheters, needles, syringes, surgical supplies, heat labile enzyme preparations, and some and certain antibiotics and certain what antibiotics. So these ones, of course, we are familiar with all the medical devices I just mentioned now. We are familiar with the medical devices I just mentioned now. Now let's look at sterilization using ionizing radiation. Let's look at sterilization by what? Radiation. Let's look at sterilization by radiation. Now, by radiation, of course, you've done your radioactivity, so you know what radiations are. So let us waste time trying to talk about radiation. Let's go straight to the point. But these techniques make use of gamma rays and cathode rays. Very important. Gamma rays and cathode rays are used in sterilization by ionizing radiation. Gamma rays and what? And cathode rays. Now, this one is limited. Use of this one is limited because of the equipment you use here is specialized equipment. It's not what you can see anyhow. And also because of the effect of the radiation. Remember radiation effect on our system. Because of the radiation, getting exposed to all this radiation is a problem. So that's why the use is limited. But it's effective anyway. So here, what does it do? This radiation has some chemical or alter some chemicals in the microorganism. So, and this make them to be taken care of. Are we together? Now, actually, the exact mechanism of action is still under investigation anyway. But one basic thing there is that it's effective. But the problem is what? The irradiation, getting exposed to this was radiation. So having looked at the different equipment, different sterilization methods, let's look at something. I want us to say one or two things on dosage forms that are sterile. Let's spend some time on sterile dosage forms. Let's spend some time on sterile dosage forms. Let's spend some time on sterile dosage form, even though I don't know whether you still do it, but I just want to say one or two things about sterile dosage forms. Or have you done it? Hello? Let me not repeat it again. Have you done sterile dosage forms? Hello? Hello? Are we there? Hello?
We are there.
Ask a question. Have you done
We are
sterile?
with you.
Have you done sterile dosage form?
No,
Huh?
no, we are with you.
Did you get my question?
We've not done it, sir.
Okay.
Which
Alright,
question?
so let's just say one or two things about steroid dosage form. We have talked about equipment, talked about how to keep the environment sterile. We've talked about the sterilization process. So I want us to just talk about sterile products a bit. But before we do that, I want us to first talk about the ideal properties of a sterile dosage forms. Ideal properties. What properties are they supposed to have? Most of the sterile dosage forms are used for parenteral and ophthalmic purposes. So most of the parenteral and ophthalmic preparations are sterile. So what are the ideal properties they should have? And what they should want is that, of course, I told you before now, they should be sterile. That one is normal. I'll be talking about it. They should be what? Sterile. So they should be sterile, devoid of all forms of what? Microorganisms. In fact, the one used for the eye preparation, that is ophthalmic preparation, formulation, that one should be specially be free of a gram-negative bacterium we call Pseudomonas aeruginosa. Pseudomonas aeruginosa is a gram-negative bacterium. In fact, eye preparation should be specifically devoid of this, because it can cause a very serious infection on the cornea if the product is used. I have also told you about isotonic solution. I believe you did isotonic solution in your farm calc in second year. Did you do anything like that? Isotonic solution in your second year in your pharmaceutical calculation, isotonic solution. Even in your bio 101, you should do something like that. Isotonic solution. Have you done anything like that in any of your courses? Let me know where to start from. Have you done anything about isotonic solution? Hello? 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 Network is disturbing. Maybe we may stop this class at this level, so that I think we'll stop here. Network is not helping us. We'll stop here. Maybe we can do this one on site, because it's of no use if network is not allowing you, and some of you are leaving the lectures. Doesn't make sense. That's why I told you that I prefer early morning class than I prefer it to this afternoon class, because of network and the noise around. So I think we'll stop here for today. Thank you very much for your attention. At least we have spent almost 1 hour 30 minutes from 5 o'clock till now. We have tried. Thank you very much for your attention. God bless you. See you next time.